Nobody likes to come to the emergency room, but it's the best place to be if you think you might be having a heart attack. But how do you know if it's a blockage or just that spicy burrito you had for dinner? Interventional cardiologist Dr. Matthew Whitbeck of Essentia Health Heart and Vascular Center says it's challenging because heart attack symptoms can be so different for different people. People might experience chest pain, back pain, nausea, or even jaw pain. Dr. Whitbeck says many women just feel like something isn't quite right. He says when in doubt, get it checked out, especially if the pain and discomfort aren't going away after a few hours.
Whether it's heartburn or heart attack, we want to help.
If it is a heart attack, Dr. Whitbeck says there's a fairly new procedure that's getting a thumbs up from patients, and it begins right here. It's called radial artery access, and it means doctors, such as Dr. Whitbeck, are accessing the heart through the wrist instead of the leg. Basically, he's able to thread a long, thin tube through the radial artery in the wrist up to the heart, where he is then able to inject dye to look for blockages or perform other procedures to mend the artery.
By going through the arm, you not only will decrease the risk of the procedure, but it also leads to a faster recovery time. Some data even suggests the hospitalization time is minimized.
Dr. Whitbeck says the recovery time is faster because you're not required to lay flat for 6 hours like you would be with leg access. You also have less chance of excessive bleeding because of the smaller size of the arteries and less muscle soreness because the radial artery is easier to get to than the leg artery. Dr. Whitbeck received specialized training in radial artery access from Wake Forest University. He says he and his colleagues at Essentia Health are committed to this procedure because he believes in most cases it's best for his patients.
It's a huge advance. You know, I would say that when patients come back to me in the office, the one thing they comment on is the wrist. They're very happy with it. So I feel that for us, it's provided a superior level of care.
For Essentia Health Medical Insights, I'm Tracy Briggs.